Hello, everyone, and welcome to Black Maternal and Environmental Health Day. My name is Latricia Adams, CEO and President of Young, Gifted, and Green, and we are so excited to amplify this very important day. We are in year two, but we know that the intersection of maternal health, specifically around Black women and Black childbirthing people and environmental justice, is an issue that should have been elevated decades ago. Tonight, you are in for a treat where we have a panel of phenomenal experts in the field to talk about this issue from a public health perspective, from an environmental justice perspective, from an environmental science perspective, and thinking about ways in which we can use this knowledge to truly amplify awareness within our own respective communities at the local level, at the state level, and think about ways we can truly help to have more healthy Black births in our respective communities. So tonight it is my honor to acknowledge and introduce our host, our MC, if you will, virtually for tonight, Dr. Rachel Morello-Frosch. Also, we'll be joined by our panel of experts, Pediatrician Dr. Harleen Marwah, also Dr. Joanne Pérodin, and Miss Yvonka Hall. So with that, I'm going to turn everything over to the dynamic and wonderful Dr. Rachel. Thank you so much.
Thanks, Latricia. It's a real pleasure to moderate this panel on Black Maternal and Environmental Health Day with Ms. Yvonka and Drs. Harleen and Joanne. Before we launch into our discussion, I just wanted to start with a little bit of framing about the importance of this topic and why we want to have this discussion. The health of pregnant people is a really key indicator of the overall health of a community, a state, or a country. And that's why health organizations like the World Health Organizations and other health bodies within the United States track this information so closely. And trends in the United States for maternal and perinatal health have steadily worsened over the last couple of decades. So outcomes like severe maternal morbidity, which includes unexpected outcomes of labor and delivery that can result in short or long-term health effects, are on the rise. And Black pregnant women experience these adverse outcomes at double the rate of white mothers. And rates among Indigenous, Latino, and Asian Pacific Islander pregnant people are also elevated. And we see similar patterns in outcomes like low birth weight and preterm birth. And research really shows that these outcomes are related to structural factors, including legacies of racism, poverty, and these impacts can be intergenerational. And then, of course, exposures to environmental hazards and other place-based stressors in our neighborhoods and in our homes. And so reproductive health advocates, civil rights, and the environmental justice movement have really been pushing policymakers and public health advocates and scientists like myself to address the cumulative impacts of environmental and structural stressors, all of which have huge implications for Black maternal and reproductive health. So to kick off this event, which on Black Maternal and Environmental Health Day, which was launched by Young, Gifted, and Green to raise awareness about the importance of clean air and water, healthy housing, safe consumer products, and overall environments for Black maternal health. I want to launch into our first questions. And as I call on moderators, if they can also just give a little bit of background on themselves and their work, I think that would be great. So I'd like to start with you first, Dr. Harleen. Can you talk a little bit about the critical importance of the prenatal environment and its long-term impacts on child health and development? And what are some of the key environmental factors that you think influence fetal programming and what we call epigenetics? And maybe you can say a little bit about what that is for our audience.
Great. Thank you so much for the question. And thank you for having me here tonight for this important discussion. as you'd already mentioned, my name is Dr. Harleen Marwah, and like many folks in the room, I wear a few hats. I'm a pediatrician. I am an editorial fellow at the New England Journal of Medicine, and I'm the founder of an organization called Medical Students for a Sustainable Future, which works to train the rising generation of physicians to care for patients in the context of climate change. So, going back to the question that you asked about the importance of the prenatal environment and its long-term impacts on child health and development. So, as a pediatrician, I see that from before birth, the environment influences how children develop by shaping their exposures. Everything from the quality of the air to the availability of clean water to the temperature outside. All of these play a role in shaping development, both through the direct impacts on a child's developing physiology, as well as some of those indirect impacts on influences on caregivers and systemic supports, like we mentioned earlier. I'll go through some examples. So if we look at heat stress on pregnancy, we know that it's been associated with things like increased risk of preterm birth, lower birth weights, increased rates of stillbirth. From before children are even born, the extreme heat is impacting them. And then after they're born, they're smaller. And so that means their bodies not only heat up quicker, but they also release less heat through sweating, which makes them more vulnerable to extreme heat. Another example we can think about is early life exposure to air pollution, which can increase a child's risk of developing asthma because it increases things like inflammation or impacts immune system development. There's also an increasing body of evidence. You asked about epigenetics earlier. So there's an increasing body of evidence that diverse pollutants can alter epigenetic programming and disease risk. Things like arsenic, tobacco, smoke, air pollutants, and other endocrine disrupting chemicals. There's also more evidence coming out that links prenatal air pollution exposure to neurodevelopmental outcomes, so how a child's brain is developing. And then these impacts, again, are further exacerbated once the child is born. Children at baseline have higher respiratory rates than adults. And so because of those higher respiratory rates, they're getting higher exposure per body weight of the air pollution in the air. So poor air quality places them at increased risks of respiratory diseases. And we know that the burden of air pollution is something that's not shared equally, largely due to this systemic injustices that have been in place for generations. Another pathway we can look at is extreme weather events. Children have different nutrition and fluid requirements than adults. So when extreme weather threatens food and water supplies, children are left particularly susceptible, especially if you think about a breastfeeding mother who now does not have access to adequate nutrition. And then on the other hand, we can also look at positive environmental influences, things like clean air, safe green spaces. All of those things can promote healthy development. But again, we know that there's disproportionate access to those positive environmental influences. Ultimately, we know that the health burdens of environmental injustices are not shouldered equally. And these impacts are deeply interconnected with maternal health. And for me, these numbers, these aren't just numbers in science. These are human lives. When a heat wave hits and a mother goes into preterm labor unexpectedly, when a child develops severe persistent asthma simply for playing outside, when a mother shows up to clinic in tears looking for solutions to protect their children, these concepts continue to reinforce that these are human lives. For me as a doctor, when a code alarm goes off, I'm trained to respond, and it feels like the alarm has been sounded on environmental and maternal health, and our action really is overdue. So, I think being part of this panel today, hearing about solutions from everyone really reminds us of the importance of meeting this moment.
Thank you, Dr. Harleen. It seems like also you are making that connection, both as a researcher, kind of thinking statistically about the disproportionate impacts of things like climate change and air pollution on Black pregnant women in particular, and its implications for maternal and environmental health. But also as a physician, you see the faces that form the basis of those statistics that we often talk about. So I think that's really important. And I just also, to clarify this notion of epigenetic programming, it's really about the ways in which these exposures affect normal genetic function as opposed to genetic mutations themselves. which the science is really starting to uncover the importance of that. So I appreciate that. Thanks. Ms. Yvonka, can you say a little bit about your work and your background, and then as an environmental justice advocate, tell us how you think toxic exposures in the home and community, such as air pollution, lead, exposures to hormone disrupting chemicals, contribute to poor maternal health outcomes for Black women. And what do you think the policy changes are needed to protect this group of pregnant women?
I think Dr. Marwah said it all, but I want to make sure. I am Yvonka Hall. I am the executive director of the nationally recognized Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. So our work is to address the cumulative impact of racial, economic, environmental, and social justice inequity. So we look at the social, structural, environmental, and behavioral determinants of health, and then we work with our community to educate, advocate for, and empower. And so I want to start off, as I always start off, with a little story around background. I started doing this work 31 years ago, but I had an aunt who would have been 98 years old had she lived. There was an article on November of 1964 in Jet magazine, and it said, Cleveland mother has baby after 17 losses. Mrs. Evans J. Martin of Cleveland, Ohio, gave birth to a 4-pound, 14.5-ounce baby boy, Grant Lamar, who arrived after a series of 17 miscarriages. My aunt moved from West Virginia to Cleveland, Ohio, right before 1954, before my cousin was born, and she had experienced those 17 losses before then. We talk about the things that are going on in West Virginia, but we also have to talk about all the things that are going on across the country environmentally. And so when we look at the things that are going on in the African American communities or in communities of concern, we really don't see a big shift in what has happened in 1964 with those 17 losses and what we see now. And so if I wanted to title a presentation, I could go, when the red line meets the bread line, when the meets the lead line meets the maternal and infant chalk line. And so because we know that all of those things are interconnected, when you talk about where people live, when you talk about their zip code, when you talk about racism and the impact, we have to talk about the things that are going on in the neighborhood environment, in the in-home environment. And so there's a relation that the doctor talked about between asthma and infant mortality. You know, in Cleveland, particularly when we had the Canadian wildfires, we had a number of experiences with moms going into preterm labor and having a lot of children that died. African-American children in Ohio are 14 times more likely to die than their white counterparts of an asthma attack. And so when we talk about what's going on in birth outcomes, particularly when we know that gestational asthma impacts the airways. And so looking at making it harder for you to breathe during pregnancy and then looking at those end results are important. When we look at tobacco, the number of how the tobacco corporations have deliberately targeted our communities. We have a lot of women that are addicted to menthol products. So they're addicted to menthol. And so because of that addiction and because of what menthol does is menthol allows the poison to go deeper into your lungs because it stops the coughing reflux. So normally if you're taking in poison, your body would try to eject it. And so think about smoking in terms of a pregnant woman. And so we have lots of women who are addicted to cigarettes because they have been targeted with menthol and flavor, particularly around vaping devices, particularly for younger people, but also just for mentholated cigarettes for women as they age. And so when we look at the things that are going on, we have to make sure that we understand the correlation between that. But looking at lead poisoning, understanding what's going on for many cities, looking at Michigan around the water, but in Cleveland, understand what's going on here with paint. So leaded paint and what it does to the reproductive system. And so looking at the miscarriage, stillbirth, and premature birth of pregnant women as it regards to our lead poison crisis that we have here. So we have to make sure that we're looking at what lead is doing, looking at the indoor, looking at our gas stoves and trying to get people to convert from gas stoves to electric stoves is very hard for communities that are used to using gas stoves. So we can talk to them till we're blue in the face about the benefits of an electric range. But when you have this whole historical piece of people using a gas stove, you have a lot to contend with. So trying to make sure that it's more affordable, creating policies where it is more affordable. The other thing is around this non-stick cooking things that people are using, whether it's their utensils or whether it's their pots and pans, making sure that if those things become, if there's an opening in them or if they become scratched, that you need to get rid of them, that you can't use those things because it is putting all of those toxins into your food. And so we have a lot of communities that, if you're poor and you're not able to afford new things, you're using the same things. And so trying to make sure that people have access to those things, particularly people who are pregnant, looking at plastic containers, we have lots of plastic everywhere, whether we're talking about water bottles or whether we're talking about the fish, particularly, I'm here on the Great Lakes. We're looking at the amount of plastics that we have in our fish. And so where people used to say, I'm eating nutritiously because I eat fish every day. Well, doctors tell you now you can't do that. When you look at the number of substances that are found in fish, particularly plastics, then that makes it very alarming when we're talking about how do you change food and make sure that food is healthy for people in their pregnancies. So getting rid of gas stoves, looking at nonstick coatings and nonstick devices, plastic and plastic containers, looking at lead and saying, makeups. For people who are also pregnant and may have cravings for like cinnamon applesauce, understanding that we actually have a big recall around applesauce with cinnamon in it. And it's not because of the applesauce, it's because of the lead in the cinnamon. So because of the lead in the cinnamon, making sure that people understand the correlation between the lead and the cinnamon in their bodies. We have a lot of families that are using microwaves. So understanding how toxic compounds break down over time in homes and the things that people are using every single day, making sure that there's money for cleaning up the lead and making sure that there's continued money for lead pipe replacement. So when we're looking at these policy things, so we know that we put in this thing around lead pipe replacement, but as you know, we've had a lot of big changes recently. So hoping that program is not one of the ones that gets left behind. Looking at our healthcare and looking at housing, understanding that if we're building new houses, we need to be building them more user-friendly and making sure that we're being mindful of the toxins that are in the community. Looking at our treescapes and what goes on, particularly in inner city neighborhoods that don't have trees, and what happens to people who are breathing in lots of contaminants every single day, all the time. And so looking at those things that are going in our community and saying, how do we create policies that address implicit bias in medicine while promoting programs that remedy socially embedded health disparities? How do we look at this racism as a public health crisis that has been declared in all of these places across the country, and saying you must include policies to address lead poisoning, to address particulate matter 2.5. We must address the impact of menthol, carbon emissions, food apartheid for at-risk communities, polluted waterways. We talked about the fish, the pesticides that people are using, particularly in their homes, when we have a lot of people that are being impacted by bed bugs and they're using those, and those things ultimately end up in your body. The air quality, looking at heavy metals in soil, lack of tree canopies, people that are living near toxic dumps, and chronic illnesses are related to these environmental contaminants that impact pregnant women and also our babies. And so looking at these policies and saying, how can we make sure that we have land use policies that are effective and remediative for communities that are disproportionately impacted. But understanding in all of this that the red line truly does meet the red line, the red line truly does meet the infant and mortality chalk line, and how do we address those things with policy?
Thank you, Ms. Yvonka. I appreciated how you pulled together both exposures to like legacy contaminants like lead paint in homes, even though we've discontinued its use in paint since the 1970s. Older homes still have that old paint there as an example, to current consumer use products. And then I really liked how you elevated the issue of corporate harm that disproportionately impacts and target market certain products, whether it's menthol cigarette products or even certain kinds of endocrine disrupting containing beauty products towards women of color and Black women in particular, and its implications for maternal and reproductive health. So thank you for that. I wanted to ask Dr. Joanne, you've been doing a lot of work on the issue of climate change and climate resilience. Can you say a little bit about some of the unique environmental health challenges that women face during pregnancy, and specifically how can disaster risk reduction and climate and public health initiatives address these disparities to improve maternal health, particularly among Black women?
Thank you, Dr. Rachel. It's a pleasure to be part of this wonderful panel today. My name is Joanne Pérodin, and I'm the Vice President of Programs at the CLEO Institute. We are a nonprofit organization working on climate education, engagement, and advocacy. I'm also a trained social scientist in disaster risk reductions. So my research explores different elements that influence how we address risks when talking about disasters, and the best practices that can be explored for designing initiatives that can reduce vulnerabilities in communities. So to answer your question, I would say that Dr. Marwah and Ms. Yvonka have highlighted so many critical points that transition pretty well into the question that you presented with regards to maternal health and dealing with the evolution of the state of our climate and dealing with disaster risk. I would say we are in a period where, on the one hand, legacy pollution continues to be an issue, but at the same time, we are facing events that are exacerbating or increasing vulnerabilities with regards to the safety of not just Black women, but society in general. So, for example, if we're talking about extreme heat, just the past 10 years have been the warmest years on the planet. And when we're talking about the risks that this means for Black maternal health, Dr. Marwah already highlighted some of the implications of the development of infants with regards to extreme heat exposure. But if we're talking about extreme weather events such as wildfires, hurricanes, if there's power outage and you're in the middle of the summer, that means you do not have access to air conditioning, or let's assume that the impact of the hurricane is so catastrophic that you end up losing your job, you end up being displaced. So not only are you dealing with the mental health aspect of this incident, but also you may not have the financial means to afford your utility bills. And in that case, if you cannot afford your utility bills, you're likely to be disconnected. And if you are disconnected, that means you cannot have access to a cooling center. So in that instance, those circumstances further increase the risk of a pregnant woman to get sick when it's really hot, and they are at higher risk for getting heat exhaustion, heat stroke, or other heat-related illnesses. So if we're looking at the positive or a solution oriented to address those risks, we cannot talk about air pollution without talking about what's contributing to air pollution and what's exacerbating or increasing the negative effect of air pollution. So when we're talking about environmental health, any initiative that aims to reduce the risk on Black pregnant women or infant should also talk about housing. Do we have homes that are resilient, meaning that it's resilient to the climate, it's weather control? Are they affordable? Is noise pollution in the area manageable? Is the home in an area that has a high traffic flow, which would not only contribute to noise pollution, but also air pollution? Is the neighborhood properly designed, meaning do you have access to sidewalks so that you can walk to get your physical activity or walk to have access to a public transportation stop if there is a stop for public transportation? And we also need to talk about like access to food that is affordable, that is healthy. But with the state of our climate, because of flooding, because of sea level rise, because of extreme heat, is becoming more complicated to grow food. And with the technologies that we have to invest in our ability to grow food, that drives the cost of food. So it's not only about pollution, but it's also about affordability, and it's also about the well-being of communities. Another element that I would like to add with the wildfires that we're seeing, let's say in a neighborhood that is going through a wildfire and you have many of those homes that have lead paint in them. What happens when those homes burn down? And then now you have particles that have a combination of toxic materials. So when we're talking about investigation, understanding what kind of exposures are we dealing with, there needs to be, I don't know if I should say a cry or more attention in investigating and understanding what we are now dealing with in terms of exposures to multiple toxicants, but also how we are likely to be exposed to those toxicants, whether it be by air, soil, and water. Still about wildfires, the flame retardants or chemicals that are used to contain those wildfires, what happens once the dust settles and let's say you have heavy rain, where do those products or byproducts end up? And is this something that is going to be mixed with our natural water sources, or is this something that may end up on the soil of a private residential property? So when we're talking about reducing the risk, on the one hand, there needs to be ongoing awareness building, not just for Black pregnant women, but also for their social support system, in doctors' offices, and businesses, and also policymakers who are making decisions on policy that ultimately will have an impact on our livelihood. And those educational materials need to be targeted. We need to understand the context in which we are addressing those issues and the audience that we're engaging with. The way how we engage with a policymaker is not necessarily going to be the way we engage with a scientist or a community-based organization. So recognizing the context in which we're talking about those issues is important. And when we're talking about disaster preparedness plan, who are we addressing as vulnerable individuals or communities? So expanding that group of individuals, are we talking about people who have limited mobility, or are we talking about individuals who are pregnant, or are we talking about individuals who've been dealing with multiple vulnerabilities and disparities and inequities? So recognizing the different groups and how they've been affected over time and are still being affected by those events is another area that I would highlight.
Thank you, Dr. Joanne. So you gave us a nice segue to our next question, but I want to lift up your strong point that, really thinking about awareness and adaptation strategies need to not only focus on Black women themselves and Black expectant mothers themselves, but also on their support systems and decision makers, healthcare providers. And we need to acknowledge the heterogeneity of the vulnerable populations that we're talking about, including folks, for example, that have different kinds of physical or mental health disabilities that can make them uniquely vulnerable to some of the effects of climate change that you were describing, wildfire, extreme heat, flooding, etc. So thank you for that. So for all our panelists, these are challenging times. People are feeling like movement towards addressing environmental justice is facing some significant setbacks, particularly at the federal level. So I'm wondering if each of you could maybe describe one or two tangible steps that Black women can take to reduce harmful exposures and create a healthier prenatal environment for themselves and their babies. And given what's going on, how can we empower communities to advocate for environmental justice in ways that support Black maternal and environmental health? So I'll start with Dr. Harleen, and then Ms. Yvonka, and then Dr. Joanne. And just, 1 to 2 tangible steps, just so that people have some takeaways at the individual level about what people can do.
Great. Yeah. Thank you for the question. And I think, my co-panelists have already given some insightful and innovative solution proposals. I think for me, when you ask this question, I can't help but remember a patient and a family that really impacted me when I was a medical student. I took care of this family of 5 siblings, children ranging from ages 5 to 15, who all had mild to moderate persistent asthma. And their mother was chatting with me in clinic and just so concerned about how she could care for her children who were all suffering from a range of severity of the same illness, and really saying, it was summer vacation time. And she's like, how can I stop my children from going outside and playing? But going outside and playing is putting them in harm's way. And that really impacted me. And I think about this family all the time. But one of the things that we did with the mom and with all the kids is we sat down and we learned how to read the air quality index. It's unfortunate that it's something that I was having to teach a 5-year-old how to do, but at the same time, empowering them with the education about their illness and about the risk factors around their illness was something that at least gave them something in their toolbox to adapt and mitigate their risk in the immediate day-to-day. The air quality index also had at that time, if it still exists on the website, it had a specific toolkit that you could download and give to your teachers at school as well, so that teachers and other folks at school who were caring for the children had a sense of what the air quality index meant for a child with asthma, because of course that's a lower threshold for what's for when they need to start taking precautions and changing their medication regimen and things like that. And so I think that's one tangible step that folks can take is just understanding the risk factors and understanding how they interplay with their current diseases or the diseases of their loved ones so that they can manage, at least in the day-to-day, the understanding of the risks around them. And then I think, not putting it all on the community who's suffering, but really being able to find who your partners are in this space who can go on to advocate for you. So I was really moved that this mom trusted me to talk to me about the fears and the struggle she was having in caring for her children. And then I saw that now as my responsibility to go and amplify this pattern of health challenges that I was seeing, to start advocating for more stringent clean air standards and to really, put that human story in front of folks. I think one of my, favorite environmental heroes always says, numbers numb and stories stick. And I think as a physician that one of my, unique vantage points is that I'm constantly collecting stories of patients who are telling me about the things they're struggling with every day. And really, when you see those stories start to pick up a pattern, it's important that we're amplifying those and transitioning those into some meaningful changes that we need to see in society. And so I think, there's definitely a lot of work that needs to be done, but in the day-to-day, helping folks kind of navigate the risk factors while also finding them effective partners to work on those systematic changes is one place we can start.
Thank you. Excellent. So, Ms. Yvonka, 1 or 2 tangible steps.
So I think, it's important for us to make sure that we have community engagement at the heart of all of our work, making sure that community understands the issues that are impacting them, and then actually teaching them how to advocate. How do they advocate for themselves, particularly when they're talking to legislators, because a lot of them have never talked to legislators. Looking at some of the other gaps in systems around bus routes and transportation. Do they have what's needed in order for them to get to a doctor's appointment? Making sure that bringing back neighborhood clinics to the neighborhood. I don't know if people have realized, but over the last 25 years, neighborhood clinics have gotten far away from the neighborhoods. And so the neighborhoods that those clinics were initially put in to guide the health and well-being under the Civil Rights Act of 1964, what we've been seeing is they have moved further and further away from communities of concern. And so we cannot address the issues for people who have a story to tell. And I think that for many of us, when we talk about infant and maternal mortality, we have so many stories. We have people who've lost their lives, whether they, have lost, a daughter that had a baby and her and the baby died, or whether she lived and, the baby died, or, I have all of these stories that people come to me with. And for me, making sure that their story is amplified, making sure that they understand and that other people understand that their lives matter. And so for me, those things are important. So the transportation piece, making sure that that we're looking at the treescapes in our neighborhood, particularly in urban communities. We have I would tell people, to go and put trees in your yard, but we're talking about a lot of community members that don't own a home. They're renters. And so what are some of the things that we can put in place for landlords, whether it is forcing landlords to be compliant with lead-safe housing? We know that we cannot make anything lead-free, but looking at how do we make things lead-safe? And the other thing is looking at, some of the things that we're bringing in or some of the things we're doing. Although lead in paint was outlawed in 1978, we still have brands of paint that are sold in third world countries that still have lead paint in them. Dutch Boy brand is one of those brands. Dutch Boy brand paint still makes paint with lead. It is still sold with lead. And so looking at the number of toys, cosmetics, herbal remedies, we do a lot of things because our mothers and our grandmothers told us to. And so dispelling some of the myths around some of the things that we thought were good for us. So I think that in community engagement and educating the community is going to be paramount to the success of any type of initiative when we're talking about how do we do better around infant and maternal mortality. But first and foremost, we have to do something about racism in America. We have to do something to address the racial complexities that African American women face every single day. If we are to look at this elephant that is in all of these rooms and all of these spaces that disproportionately impact infant and maternal mortality in African communities. And so for me, that is my takeaway. Thank you.
Thank you, Ms. Yvonka. And Joanne, what would you add to these for 1 to 2 tangible steps?
2 tangible steps. The first one I think building trust, working with trusted messengers and identifying trusted leaders is an important first step to organize, especially when we look at the compounding effects of the multiple disasters that we're dealing with, whether it be conflict related or environmental related. We are seeing a lot of displacement. So therefore, there's a lot of disruption in this social network fabric that have existed. The second one is promoting cross-sectoral collaboration. And when I say cross-sectoral, that means private sector, public sector, academic institutions, individuals, community groups, everyone who is impacted by this issue needs to have a seat at the table. And if we could find a way to build strong relationships between research groups and community groups, then we're in a position to advocate for strong policy strategies to make change. So those would be my two tangible steps.
Excellent. Great suggestions. So just to recap, really empowering folks that are impacted with information in order to manage risk factors, but acknowledging that it's not only the duty of the individual to protect themselves, really thinking about finding allies and partners who can help and elevate cross-sector collaborations, whether that's public and private partnerships or academic and community research partnerships, building trust and identifying leaders for organizing, working, with landlords, for example, to improve household and neighborhood environments, acknowledging that not everyone's a homeowner and is empowered to do that just themselves. Dealing with the elephant in the room, the role of historical and current day structural racism that affects Black maternal and environmental health, and really thinking about access to healthcare, whether that's putting clinics back in neighborhoods, or ensuring that people have adequate transit options to get to healthcare. And then how do we empower people to be able to undertake community engagement and themselves become educators and organizers, and even more importantly, reaching decision makers to push for policy change. So thank you for that amazing list, all of you. Dr. Harleen, I wanted to circle back because we've been kind of touching on the issue of the healthcare system. And I think it's amazing here in this country, we spend a ton of money on healthcare. And given how much we spend, the health outcomes are a little underwhelming compared to other industrialized countries that are even less wealthier than the United States. So can you say a little bit more about what's the role of the healthcare system in addressing environmental contributors to adverse birth outcomes that disproportionately affect Black women? And how can healthcare providers, whether you're a doctor or a doula or a nurse, or how can providers better incorporate environmental health into prenatal care?
Yeah, thanks for the question. And I think we've already said it, but just to kind of reinforce, we know that maternal health outcomes in the US are far worse than other similar economic countries. And that's largely influenced by systemic and structural discrimination. And we know that to adequately address issues in this area, we must address deep-rooted systemic injustices and racism across society. Health systems really should be a cultivator of health, so they're uniquely positioned to be a leader and drive meaningful change in this space. But I think to start, health systems also have to take a look in the mirror and do some internal reflection on what their own contribution is to the challenge as well. I think we've already heard kind of about issues that exist with trust, the health system's trust building with communities, access to healthcare within the community. And then I think from an environmental contributor standpoint, the health system's contributions to climate change, their carbon emissions, their greenhouse gas emissions, the waste that they generate. And so health system sustainability really does need to be a top priority for health systems in cultivating and promoting healthy environments. So really doing an internal look at the health system's operations and where there's opportunities for health systems to become more sustainable, I think is definitely a huge opportunity that health systems have. I think another opportunity that health systems have is to help more effectively track action and impact. So we need more nuanced data on maternal health and neonatal health that we can integrate into metrics and research to drive policy and other initiatives. For example, when we're tracking the health impacts of extreme heat, we really should be including the impact of heat on pregnancy and birth outcomes. And if we're not including that in our denominator or in our total number there, then we're really missing the mark and missing a huge opportunity to adequately put resources towards what's happening in that scenario. I think another thing is that we have an opportunity to leverage budding technology and AI creatively in order to identify which patients are high risk and how can we dedicate resources appropriately. So for example, if you're thinking about going on to your electronic health record, thinking about how your zip code might link to some of those environmental risk factors, whether there's been a recent wildfire in your area, whether there's been recent poor air quality, whether you've had more extreme heat events happening, and using that to kind of trigger a warning or trigger information going to you or trigger a patient outreach coordinator reaching out to certain communities to make sure that they have resources and knowledge and information and to kind of prepare with that disaster response that we heard about earlier and kind of linking up patients with unique vulnerabilities across the spectrum of vulnerability that we talked about earlier with those risk factors. And so I think with emerging technology, there's really opportunities for us to have a positive impact. And then finally, I think as clinicians, and you talked about kind of there's a whole spectrum of clinicians who drive a lot of meaningful care for patients. Everyone, you said, from like doulas to nurses to pharmacists to physicians to other advanced practice providers. Really, all clinicians must be equipped with knowledge about these environmental influences to more effectively counsel patients, to maintain appropriate differential diagnoses, and then to appropriately advocate for the communities that they serve. So we know that thinking about medical education, we need to start incorporating more of these environmental influences, both on kind of our anticipatory counseling, but also on how it's influencing what diagnoses someone might present with, or if the way that they're presenting with diagnoses look different. For example, we know that tick-borne illnesses or mosquito vector kind of transmitted illnesses that used to exist in one geography are now expanding due to the changing climate. And so it's important for clinicians to be aware of that so that if a patient presents with symptoms that match one of those illnesses, even if they're in a geography that wasn't previously matched with those illnesses, they know to keep it on the differential so a patient isn't getting a delayed diagnosis. And then I think, thinking about clinicians as well, we know that outcomes improve for patients when a doctor shares the common background with their patients. And so I think that, again, underscores the need to improve access to medical training for all communities as well.
Thank you. Excellent. I want to move to Dr. Joanne because you touched on this earlier, but I'm hoping you can expand a little bit more on thinking about cross-sectoral collaborations between public health, environmental advocacy organizations, community groups, and you referred also to public and private partnerships. So could you talk a little bit more about these, maybe with some examples, and how you think they can strengthen support for Black mothers, both, before, during, and after pregnancy?
So I'll start with a story that happened over the weekend. I was chatting with a colleague of mine, and there was a community event at a church, and people were learning about what's happening with our weather. And during the meeting, someone got a phone call, and it was a single mom with 3 kids who was calling the church to let them know that her electricity was disconnected and she didn't have any money to pay for her utility bill and to restore electricity. But what I also learned is in that county, when electricity is shut off, so is your water. What if that was a pregnant woman? What would have been, what would the situation look like? Not that what happened over the weekend was bad, but if you're talking about someone who's bringing a new life into this world, you don't have access to water to wash your hands. So talking about like hygiene, you don't have water to flush your toilet. If you're in the middle of an extreme heat season, you don't have any way to cool your home. So I'm bringing this up because some people may have no idea what the implications are when resources are disconnected or unaffordable to an individual. So having someone who lives those experiences has to be at the table, because without those personal stories, we will not be aware of those incidences. Having, let's say, an urban planner or an architect at the table gives the opportunity to explore how can we improve the way how we're building the infrastructure or the built environment of our society. Having a scientist may allow conducting further investigation to understand the scale of similar events. And if it's someone who's, if it's a scholar in the public policy field, they might further look into what are the economic impacts, what are the best political or policy strategies to engage with policymakers, and how to formulate communication plans to engage with those policymakers. And community groups, community organizations, trusted leaders, without those entities, we cannot have a full understanding of what's happening underground, especially when we're talking about groups that are facing high vulnerabilities. So therefore, you know, by having diverse representation at the table, it creates that space where we can scale or grow our understanding of the complex society that we live in. And when we're talking about Black maternal health, it also stresses on the ongoing obstacles, challenges, issues that those communities are facing. And not just like Black women or Black pregnant women, but also their social support system. Because when you are hyper vulnerable, when you do not have access to resources that are critical to your well-being, it also puts stress on your support system. So therefore, I think having that diverse representation, not just based on lived experiences, but to use that as a teachable moment to understand the context in which we're having those conversations, to make this world a better place and to also improve the health of Black maternal health and Black infants can bring a lot of values and can also create a better living for these groups.
Thank you so much. I think one thread that's run through everyone's reflections on the questions we've been talking about today is the importance not only of research, but the importance of storytelling to really kind of make these issues real for people, especially as we're thinking about reaching decision makers or community organizing or engaging communities and expanding, you know, organizing networks. So I really appreciate that thread and the importance, particularly I as a scientist who crunches a lot of numbers, it's really important to kind of tell the stories behind those statistics to move things forward. And this sort of takes me to our kind of final question for all of you is Young, Gifted, and Green created, Black Maternal and Environmental Health Day as a critical opportunity to raise awareness and inspire action. I would love it if each of you could, for our audience, provide kind of a final message that you would want to share that would motivate people to get involved at the local level or even beyond the local level in protecting the health of what some people call our first environment, or the in utero environment, the womb. So yeah, I will start with Ms. Yvonka, and then Dr. Harleen, and have Dr. Joanne close us up.
So one of the things that I shared with you at the very beginning was the story of my aunt, but I always kind of interweave the stories of friends and other relatives when I do talks in the community. One of them is one of my mentors, and she would always leave us with these words. Her name was Cheryl Boyce, and she was the first director of an office dedicated to minority health here in the state of Ohio. And she would say, go to the people, live with them, learn from them, love them, start with what they know, build with what they have, but with the best leaders, when the work is done, the task accomplished, the people will say, we have done this ourselves. So for me, I am those that I seek. I'm no different than the people that I'm working with in the community. I share very similar stories. I've had 2 miscarriages. I have a son that is 28, but I would have had a son that was older than him and a son that was younger than him. And so it is important for me to not only tell my story, but be able to tell the stories of the voiceless, of the women that are not here to tell their stories. And so for us, making sure that we are always inclusive of not only the women, but also the men, because Black men hurt also. And so making sure that we interweave their stories around what is going on with their partners and the women that they love that are losing children, because they're also at a loss. And so that would be what I would leave my audience with. Thank you.
Thank you, Ms. Yvonka. Dr. Harleen?
Yeah, thank you. That was very inspiring. I think for me, it's my privilege and joy to work in pediatrics and care for patients, families, and then work alongside other inspiring healthcare workers. In my work, one thing we often tell each other is never worry alone. If you're faced with a challenging situation, an uncertain diagnosis, you call someone. You should, if you're worrying, you should call someone and worry together. I think our scariest problems, our most complex medical challenges, they're tackled through that framework of teamwork, collaboration, and collective action. We rely on that framework to save lives every day. And as we kind of go through today's discussion, we reflect on how big and complex these challenges are. But I think I'm leaving today also so thankful that we have each other to call on. And I'm confident that our collective worry will continue to transform into collective action. And it's that community aspect of this that fills me with hope to continue to take action. And I think generates hope for others to take action as well.
Thank you. Dr. Joanne?
Yes. And for me, a set of questions that usually drive how I engage in spaces that are trying to identify solution, what kind of actions to take to reduce those risks, is when we're dealing with an issue, what is that issue? Where is that issue happening? Who is talking about that issue? And when we're looking for solutions, who are those solutions intended for? So the first step is, when we are looking for ways to reduce those risks, there needs to be a commitment, a will to advocate for those changes. The second one, in order to create change, we need to be big in numbers. The bigger we are as a collaboration or as a network, the more powerful we are. But for true power, there needs to be diversity in those numbers, whether it be diversity in values, culture, experiences, expertise, that diversity and network system should be present. But lastly, as a society and as communities who have been disproportionately impacted by this, by our environment and by environmental injustices, there needs to be empathy in the work that we're doing, and that needs to be embedded in like any advocacy initiatives that we are engaging in or promoting. At the same time, we also want to make sure that we are creating space to take care of ourselves, our loved ones, and those that we are supporting. Because otherwise you can't run a car on an empty fuel tank. But since we're advocating for greenhouse gas emission, we can't run a car on a low battery. So those would be some of my takeaways that I would share with our audience.
Thank you, Dr. Joanne. I want to circle back to your last point and have you each comment. You said that we need to create, those of us working on these issues, we also need to create space to take care of ourselves. And I'm sure there's some organizers in the audience. So yeah, could each of you maybe give us a really brief reflection on how you try and do that in your work so that you can keep going and not be running on a car with an electric car with no charge or yeah. So maybe I'll start with Ms. Yvonka.
Definitely. I used to work until about 2 o'clock in the morning, and then I would go to bed, and then at 5 o'clock in the morning, I was up and running again. And then, I got to a point where I said, you know what, if I do this, I won't be here long. If I continue to do this, I won't be here long. I think when I was younger, I used to say, I'll sleep when I die. That was my whole thing, but I make space for myself. So at 5:30, at 4:30, when my workday is over, I literally shut down. I shut down my office and I have a huge office in my house. And my staff is here. And I tell everybody, our day is over. Have a good day. Some days, particularly in the summer, we let out early. We go home early. Some days I'm like, okay, we're leaving. But I also cook. I cook every single day for my staff. So I cook lunch every single day for my team. And so I have 7 staff. And so every single day I prepare something that they have, something to eat that's healthy. And so for me, that's important because I think too, when we're on the run, we don't really eat healthy. We kind of eat fast food, and I didn't want my staff to be like that.
Well, thank you. So sleeping and eating well. Dr. Harleen?
Yeah, great. I mean, talking about keeping your battery going, right? Good food, good sleep. For me, I go back to this exercise that I think Ayanna Elizabeth Johnson created. It's a climate action Venn diagram for those who haven't seen it. And it really asks you to, write down what you're good at, what work needs doing, and what brings you joy. And if you can find what's at the center of that, it'll help you come up with the climate solution that may make sense for you to work on. And so when I think about the things that bring me joy and things that I find myself doing, also outside of this space, it's always about building community. And so when I have opportunities to build community and build coalition within this work, I know it's something that oftentimes needs doing, but it's also something that brings me joy. And so when you can find that overlap between the work you're doing and how it fills your cup, that's something that, helps me, I think, in the day-to-day of the actual work. And then I think outside of that, finding ways that your work kind of refuels you. So for me, not only is it the things that bring me joy, but it's also, the deep gratitude that I have in taking care of children and the kind of boundless optimism and energy and hope that they give me in my life as well. I feel like I am constantly, refueled by caring for my patients as well. And so I think, having those distinct kind of boundaries and opportunities to recharge is equally important. And then finding out like what are those pieces of your work that bring you joy, and how can you fiercely protect and hold on to those pieces of your work as well.
Thank you. And Dr. Joanne, and then I'll pass it on to Ms. Latricia to close us out.
So there are two buckets for me. There's the physical well-being, so making sure that I get enough sleep and eat. And Miss Yvonka, let me know when the next lunch gathering is. But there's also the mental piece. I do have a lot of gratitude for the work that I do and the colleagues that I'm surrounded by and the communities that I engage with. One program that we have is called Empowering Resilient Women. And in this program, we build leadership and we share experiences and our personal stories as far as how we are affected by different issues in our surrounding, whether it be food security, gentrification, civic engagement, public health, hurricane season, extreme heat. And just the testimonials that I receive from the women who go through our program and complete our program and see them move on by either forming their own 501c3 organization or bringing others into that space tells me that I'm doing something right and tells me that I have people who trust in me. And I also trust those individuals for allowing me to step in that space.
Thank you. Thank you all so much. Those are great reflections, and you gave our audience some great pearls of wisdom and strategies for action to work on this issue that we all care so much about. I'm going to pass the baton back to Latricia to close us out.
I echo that. Thank you all so much. It is always such a blessing to be in spaces with each of you, but it's so near and dear to my heart, this particular topic. As we close out, and I'll be brief, one of my favorite people outside of my mama is Fannie Lou Hamer. And the reason why she is so important to me for a myriad of reasons, but to this particular conversation is with the injustices that she experienced with maternal and reproductive health, living in rural Mississippi. I'm a daughter of Mississippi. My daddy was born in Senatobia, Mississippi. And I want to leave with this quote: "Nobody's free until everybody's free." That's among one of my favorite quotes from Fannie Lou Hamer. And, despite what may be circling around us right now, we have to keep ourselves grounded and think back to the strong women that came before us, that have been fighting before we were even thought about, right? And be resilient and continue this work until truly we are all free, where regardless of race, regardless of zip code, you're able to, if you want to, be able to have a healthy birth. And with that, also in the words of another favorite of the late great Congressman John Lewis, let's keep getting in good trouble so that we can truly protect our first environment, which is the womb. And with that, thank you all so much for joining us this evening. Make sure that you follow us on social media at Young Gifted Green. Have a good night, y'all.